Hello and welcome to the Art of Being Human. Now this is going to be our last segment on diabetes, and the next time we meet I'm going to start something else. But I just kind of want to wrap up. And one of the things I mentioned in the last segment is the fact that certain medications can give you diabetes. And what I didn't say was certain illnesses can too. Now of course we recognize diabetes as being an illness, but there are certain other illnesses that cause a person to have diabetes. They're not common. One of them is Cushing's disease, and Cushing's, I have discussed Cushing's before, but it is an illness in which there is a change in the pituitary gland, and that can cause diabetes. Acromegaly is another one. In acromegaly, there's too much growth hormone. Now the brain produces growth hormone, and that's the pituitary as well. But when you get too much of that hormone and you're an adult, you don't grow taller, but various cartilages and various parts of your body continue to grow. The earlobes, anything that has cartilage grows, even though you're not going to be any taller. It is a very odd kind of illness, and you end up by being somewhat deformed because of where the growth is. But that illness can also cause diabetes. So I just want to mention that not only do some medications cause it, but some illnesses cause it as well. Now, how do you get diagnosed as diabetic? Well, you usually, how would you know that you're diabetic? You might have symptoms and you're wondering about them. Why am I so tired? Why am I so thirsty? I had a man came in, and I'm not revealing any confidential information at all, but I had a man come in when I was doing regular counseling in my office, and he was deeply depressed. We talked about his depression. We talked about what it meant. He said, I wished I hadn't gone into the profession that I did. I would have been better off in going into something else, and I wouldn't have been so depressed. And we went on into his background and what could cause the depression. And I knew there was something. There was just some little thing I was missing. Well, he came in one day and he says, I have been so thirsty, I can't take it. When I go to the dentist, I even want to swallow the water that they rinse your teeth off with. I have to drink water all the time. And the other thing I'm doing is I'm going to the bathroom an awful lot, and I'm losing a lot of weight too. Right away, I had the diagnosis. I knew he was diabetic. I couldn't tell him that because I'm not a doctor, and I couldn't give a diagnosis, even though I knew, because you can't diagnose somebody if you're not qualified, if you don't have the medical education. But I said to him, I think I know what's wrong, and I think I know why you're depressed, and you will go see a doctor, and you will see the doctor today. Because I knew he was in a bad way. I knew his blood sugar was sky high. His blood sugar was up to 600. That's coma level. It's unfortunate he didn't even die from it. But after he was put on insulin, he's one of these people who would be type 1 right from the very beginning. And when they got it under control and he had the insulin, he started feeling so much better. He says, I'm not depressed anymore. I feel really good. I'm so glad I ended up by doing what I did for my life, for my life's work. I just love it. And he's just like a completely different person. But all he had to do was say to me, I'm thirsty all the time and I'm going to the bathroom. And I knew immediately that's probably the innermost signs, or this is probably the beginning signs of diabetes. And he was very, very, very much loaded with sugar. When my father was diagnosed, we found him on the floor. My brother found him on the floor. He had collapsed. Nobody knew there was anything wrong with him. My brother picked him up, and we were very close to the hospital. And it was, I think, winter, and the driving was bad. My brother picked him up and carried him into the hospital, and he was diagnosed and put on insulin immediately. But even though I've had the experiences of my relatives, and you may have found this to be true too, even if you've had experiences with your relatives being diabetic, there's something in you that says you'll never get it. Who? Diabetes? I'm not diabetic. I'm not, my father was, yeah, my great-grandmother was, yeah, she died of it, yeah, but I'm not diabetic, I'm not going to get it. And this is what people believe, unless they have some symptom that they have that triggers it. With me, my symptom was having foot infections. And I went to an elderly doctor. He was in practice, but he was soon to retire. And I liked him real well. He liked me, and I said, I think I've got this foot infection. Well, it was a bad foot infection. And he says, well, I must have left a little sliver of nail in you when I cut your nails the last time. And he never even gave a thought to the fact that since I kept coming back with foot infections, that there might be something else wrong. He completely missed it. Finally, I went to my own doctor, and it was a new doctor because one of my doctors had retired, and he was fixing a foot infection. He says, I can't let you out like this. You've got a terrible foot infection. And then he checked my urine, and wouldn't you know, it was loaded with sugar, and that's when I found out. But the way that you're normally diagnosed is a routine test. Usually the urine test comes first, and they find that you have sugar in the urine. Well, how come? Because the body's trying to get rid of all this extra sugar, so it causes you to have to urinate a lot. And they find the sugar in the urine, and then the next step, that you go to the hospital and you go to a lab, and they test you for your A1C. They will test your blood to see if there's anything indicated in your blood that would show that you're diabetic, and it will show up, and it'll show up fairly easily. So you usually have two tests, one on 1 week and one on the following week, one test a week for 2 consecutive weeks. And if your blood sugar is high for those 2 consecutive tests, that's considered to be a confirmed diagnosis of diabetes. So when I had that second test, I went home. My twin sister was there, and she says, well, are you diabetic? And I says, well, they think I'm diabetic. I've got high blood sugar, and they think that I am diabetic. My sister said, well, are you sure? And I says, well, we're not 100% sure. We've got to get the results of the second test. She says, so you're really not sure? She did this for a purpose. I says, well, no, we're really not sure. Good. She says, let's cheat. So she wanted to take me out for ice cream. And so I says, okay, I don't know if I'm diabetic or not. So we went out, for a Sunday and all of that. My mother was just furious, because if I was diabetic, that probably wouldn't be the best thing to do. Now, you can have a normal diet pretty much if you're diabetic, but you've got to be careful, because you have to count your carbohydrates and not go too high. I mean, I could have like a quarter of a cup of ice cream twice a week. Well, who eats a quarter of a cup of ice cream, You want to eat the whole bowl. So you have to be careful. I don't buy ice cream because I eat it too much. I just limit my purchases to what's safe for me to have. So that's the way that you become diagnosed. Now, recently, this is a recent diagnosis. They have diagnosed something called diabetic distress. Diabetic distress is interesting because it's like a new diagnosis. It has to do with the depression that you feel when you have been diagnosed with diabetes. And the point is, a lot of people become fairly depressed, and they stay kind of blue. I want to mention, though, that this is not the same thing as having a clinical depression. A clinical depression is a lot deeper. It's not the same thing as having a depression that you would have in a bipolar or unipolar disorder. It's much deeper than those bipolar and unipolar disorder. The depression is much deeper. But you have to consider that diabetes is a big stress on your body, because your body's always trying to fight to be normal. You're always trying to fight it to bring your body into a homeostasis. Homeostasis is when your body is in balance and everything works like it should, and you feel wonderful. You know, you're not under too much stress. You have enough nutrition in your body. Everything is working well. The organs are working well with each other. And it's just something that you feel good. When you get into high stress, and diabetes by itself is a high stress disease because you are always somewhat sick, because it is an illness. Any chronic illness will be the same. And depression comes with that. And so you have to constantly battle that. Now, I think when you get used to being a diabetic, and when it finally gets into your system that you're a diabetic and you handle it, then a lot of the depression leaves. Your life is different. You're doing a lot of testing, a lot of monitoring, and things that you weren't doing before. But diabetes is a stress, and it causes a stress for your mind. And so they do have this diabetic distress because of the way that psychologically you handle it. So you worry about your complications, you have constant carbohydrate counting, you feel guilt about the illness, and I want to stress again, do not feel guilty, it's not your fault, and do not let anybody else tell you that you're guilty, because it's just a bunch of crock. Don't believe it. You have guilt about skipping your exercises. If you're supposed to be on an exercise program and you don't feel like doing it, you feel guilty about that. You feel anger about not being able to eat like other people. And let's face it, chronic illnesses can be exhausting. So you have to manage all of that. You can't get up and get dressed and do simple things. You have to make sure that that you do everything right in terms of your diabetes. And it is a stress to the body, and you react to that stress to the body. So that's diabetic distress. There's no end to it. It's a constant burden. And I mentioned before, there was a woman who said being diabetic is like having a baby. It's always with you. You're always taking care of it. You always have to make sure it has enough food. You always have to make sure it has enough clothes. You always have to make sure that it's comfortable. You have to bring the right toys. If it doesn't like one toy, maybe it'll like another toy. You have to watch it if it's crawling around because you don't want it to get injured. So it's like a constant burden. And that's why this diabetic distress has been diagnosed, because your life is forever changed with any kind of a chronic illness. So it is kind of a common illness because a lot of people have it, you know. There are risk factors of having it. I want to go over those risk factors. If you have a family history of diabetes, then you're more likely to get it. If you are older, you're more likely to get it. If you lead a sedentary lifestyle, you're more likely to get it. That's because I think you're not exercising, you're not using up the extra sugar in your system, so it just raises to a higher level. There is a connection between women who have some kind of ovarian disorders and diabetes. So there is a connection there. There is a connection if you have gestational diabetes. If you have gestational diabetes and you're pregnant, it doesn't mean that you're going to get diabetes, but you may have it later on. If you have gestational diabetes, then you are diabetic for the duration of your pregnancy, and it's usually discovered at about 20 to 24 weeks. I mean, it's not something you know immediately, but as you progress in the pregnancy, you find it out. And then when you deliver the baby, the diabetes is gone. And it doesn't mean that your baby's going to be diabetic. Your baby may be larger because it's storing the extra sugar as fat in its system, so it'll be a larger baby, but it does not mean that the baby will be diabetic. And it doesn't mean once you're through having the baby that you will be diabetic. But the chances are in later years, several years down the road, you may pick up or develop diabetes, and it would be type 2. And the baby that you had that was too large because of the diabetes, it doesn't necessarily ever become diabetic, but what is more likely to happen to that baby is that around age 7 or so, they will start to get obese. Their body is used to storing fat. It did it when it was in your uterus because of the extra sugar. It couldn't metabolize all that extra sugar. It was stored as fat in the baby, so the baby became larger and heavier than it would normally be. be. And so therefore, you know, it doesn't mean that the baby's going to become diabetic, but at the age of 7 or so, they may start to become obese. And whether they develop diabetes later on, that's an open question. They may or they may not. So there are a lot of factors that you have to consider when you're talking about diabetes. So the sedentary lifestyle, the gestational diabetes, the being older, having a family history. And I want to point out again, there are a lot of people who are type 1 diabetics that have no family history at all. So don't feel guilty. Don't feel like you're to blame. It's a complicated subject. I could go on for another 2 segments. I'm not going to, but I could go on for another 2 segments just talking about the complications in terms of your mind. As soon as you're diagnosed, it's hard to wrap your head around it. Somebody told me, and I think they're probably right, once you're diagnosed with diabetes and you didn't expect it, even though you had family members with it, you just didn't, it just was not on your radar screen, it'll take a good 6 weeks before you can wrap your head around the fact that you are really a diabetic and this is serious and you have to pay attention to it. A lot of people try to ignore it. They live life as if they weren't diabetic, but then if you don't take care of it, you will have the complications. It's easier to get the complications. So if you are diabetic, it may be 6 weeks, and I can remember the way I felt when I was diagnosed and I knew for sure that I was. My reaction was, there's something wrong inside of me, and I can't see it, and I can't feel it, but there's something wrong inside of me. And there was like a sensation that went along with that, an uncomfortable sensation, but certainly not pain. And people go through that. They have several weeks. Well, I can't be. You know, not me. I'm healthy. I exercise every day. I have a good diet. There's no reason at all that I would be diabetic, but you are. You have it. It's been diagnosed, and you have to get used to the fact that you are diabetic. And it's hard to do it. It's really hard to accept any chronic illness, but you have to do it. So diabetic distress it recognizes the fact that diabetes is a constant burden to you, and it will be a constant burden, but it's not the same as a clinical depression. And people with type 1 have more difficult time than people with type 2. You know, you can be diabetic for 5 to 7 years without even knowing it, because your body manages to make up for what's going on. The pancreas just produces more and more insulin to cover for the fact that you're having a problem. But after a while, it can't do it anymore, and then it just shuts down, and it gets too tired to function, and then the blood sugar goes way up. Now, a lot of doctors have thought, and I think they're right, if you know of a person that's going to be diabetic, if you're a parent and it appears as if your child is kind of on that road, you've had some blood tests done, there is an indication that they may well end up as being diabetic, start giving them insulin early rather than later. I know we all fight insulin. Who, me, on a needle? How am I going to live my life around a needle? I know I resisted it too. But if you take a child that's going to be diabetic, there's a family history of it, and you know that that's going to happen, or the doctor suspects, giving a very small amount of insulin will rest the pancreas because it won't have to work so hard to produce. A lot of the medications that you take, the sulfonylureas, some of the medications that you take for diabetes, the purpose is to force the pancreas to produce more insulin than it wants to produce. Now, that's not good. It's not good for the pancreas. Start the insulin a little early, and then let that pancreas rest and not have to work so hard, and then it will last longer before it finally fails, and that has been shown to be the case, especially with children that are going to become diabetic. So and we're just about through, so what is the thing that you can do to help yourself? Recognize that you have a disease. It is a disease. I like to consider it a condition, but it is a disease because it has a known cause, so it's not a condition. And it's not your fault that you've got it. And if people try to tell you it's your fault for various reasons, don't pay any attention to it. It's genetic, or you had an illness, or your pancreas was, you were born with a deformed pancreas, or you have another illness or taking medication that's causing it, whatever it is not your fault that you've got it. You should not allow yourself to feel guilty at all, but take good care of yourself, because it's going to make a big, big difference in what you accomplish in life. Here, I've been diabetic for almost 30 years. My kidneys and my liver are still in good shape. There's no damage. Now, I have other complications, but those two major organ systems are perfectly normal. And it's because I've spent the time to take care of myself. And if you do take care of yourself, you can live a good, healthy, normal life. But you've got to stay with it. You know, it's like the woman with the baby. It's always with you. You've got to always take care of yourself. So I think what I'm going to do is close it here. And next time, we'll be doing something else that's completely different than diabetes. So we'll close for now. Please join me next time.